everybody, Josh Rubin from East West Healing Performance. Today I want to talk about how to pump the Quadratus Lumborum. Now, a lot of this YouTube is based off the work of people like Kapanji, his books, The Physiology of the Joints. Great books, have all three. I think I've read each one 10 times, and I continue to study them, so I highly recommend for any practitioner out there. They're great for anatomy and biomechanics. They're like no other biomechanic book I've seen. As well as the work of Guy Voyer and Philippe Druel from the osteopathic school that I've been attending for the past year. I'm currently going into my second year and absolutely loving it. So if you look at what a pumping technique is, you can actually, it's more of a French technique. You see a lot of French, Canadian, all these different osteopaths using these techniques. I'm not saying people don't in the U.S., but that's typically where it's taught. And pumping techniques are a great way to create relaxation in a muscle. You can pump a joint surface, a bone, an organ, fascia, ligament. You can really pump anything to the body to bring vitality and nutrients to it and allow it to relax and pull any toxicity, lesion, anything out of the muscle, suture, bone, ligament, whatever you're trying to pump. So here we're trying to create relaxation in the Quadratus Lumborum. Let's say if it's tight. But keep in mind, if there is tension, it doesn't always mean it's the muscle you need to treat. So I'm showing you a technique, and it's kind of going against my philosophy because I feel like we have so many technicians in our industry, and everyone's so gung-ho on learning techniques and going, well, I do ART, and I do NMT, and I do CST, and that's great, but you really know the anatomy behind what you're doing, because if you really understand the body, and you put your hands on the body and listen to it, the body's going to tell you what to do. And just because someone has low back pain doesn't mean you need to treat the back. Maybe the low back pain is coming from the subtalar joint. Maybe it's coming from the actual, maybe the patella. Maybe low back pain is coming from one of the 22 axes of rotation, the sacrum. Maybe it's coming from a suture, the OM suture in the cranium. So there's so many places it can come from. So try to really understand the anatomy behind this. And stay tuned because we're going to go into the gym and go over the technique. And I'm going to show you what it looks like. Let's look over the anatomy of this. If you study the work of Kapanji and the people that I mentioned, there's actually three fibers orientation to the fibers of the Quadratus Lumborum. Quadratus Lumborum typically, most people would say that it's in this area and it's a quad-shaped muscle. Well, it's actually not. And the thing about the muscle itself, it actually has posterior fibers. The posterior fibers are actually more, it's a deep muscle, but posterior it's more vertical, and it's the 12th rib to the iliac crest, right? So those are the iliocostal fibers. And they're vertical posterior. The more intermediate fibers, they go oblique, and those are called the iliovertebral fibers. So they actually go iliac crest to transverse processes, L1 through L4, and those are the intermediate fibers. Some people call those the iliotransverse versus the iliovertebral. And the last set of fibers are more anterior in the body. They're deep, they're more anterior. And what Kapanji calls the costo vertebral fibers, or some people call them the costo transverse. And that's the 12th rib to the transverse process of L1 to L5. So those are the three fibers of the Quadratus Lumborum. You have anterior, intermediate, and posterior. One is vertical, that's the posterior, and the intermediate and the anterior fibers are actually more oblique, one's running more medial, the other one actually runs laterally. And the interesting thing about these fibers is they're actually a continuation of the thoracolumbar fascia, which is caudal thickening, especially the iliovertebral fibers. The iliovertebral fibers, if you remember, are the more intermediate fibers. Those fibers actually create caudal thickening with the anterior part of the thoracolumbar fascia to continue on to create the iliolumbar ligaments, which go from L4 to iliac crest, L5 to iliac crest. And there's actually an anterior band on the sacrum, on the anterior part of the sacral base. The more superior band, which is the L4, is actually taught in counternutation of the sacrum, or flexion of the lumbar spine, or inhalation of the primary respiratory mechanism. And on nutation, or lumbar extension, you have tension in the more inferior band of the iliolumbar ligaments, which is the more L5 band of the iliolumbar ligaments. So if you're going to work on the QL, you always want to see what's going on with the iliolumbar ligaments, because there's typically tension in there, as well as things going on in other ligaments of the sacrum, and whether it's the sacroiliac ligament, sacrotuberous ligament, all those different ligaments need to be looked at. There's a lot of them going on in there. But always look at the QL in relation to the thoracolumbar fascia, but also L4 and L5 itself, as well as the iliolumbar ligaments. And because of where they connect into the innominate, as well as the sacrum, you need to look at the different axes of the innominate, as well as the 22 axes of rotation of the sacrum. because the sacrum goes anterior posterior, but it actually inflares and outflares. It can actually ab and adduct along the sacrum itself as well. So there's 3 different axes of movement on the innominate, so you need to look at those. So it's important to understand the anatomy of the Quadratus Lumborum and how to actually pump it. So that's my little tidbit of information on the Quadratus Lumborum, the 3 different fibers, some of its connections with the anterior layer of the thoracolumbar fascia, the iliovertebral fibers connecting with the L4-5, the more superior and inferior band of the iliolumbar ligaments. So hopefully you enjoyed that. Now let's go into the gym and actually show you how to create a pumping mechanism, or how to actually pump the Quadratus Lumborum, but actually how to pump all 3 fibers of the Quadratus Lumborum. So let's go. Alrighty, so now we're in the gym. Your patient is actually lying on their right side, so I'm going to be pumping the left Quadratus Lumborum. You can see this iliac crest. This doesn't have the 12th rib, but you want to basically, your landmarks are iliac crest and 12th rib. Now, there's some rules of thumb about pumping. You always want to pump a ligament, a muscle on exhalation, and cavities on inhalation. It really depends who you study with. But for the purpose of this, we're going to pump on basically on exhalation, 2/3 of the exhalation. Now, there's 3 different positions, and the goal of me doing this is really to educate you. It's hard to really understand the technique without someone there and showing you how to do it and practicing it. And it's hard to see the intricacies and feel it, but hopefully you get the gist of it. If you want to pump the vertical fibers of the Quadratus Lumborum, those are the iliocostal fibers, the more vertical posterior fibers, you want to make sure the person, their shoulder and hip are in alignment. The bottom knee can be bent, but you want the top leg straight. That's going to pump the posterior vertical fibers. If you want to get the more anterior fibers, you're actually going to have the patient roll slightly forward, just a little, and bring this leg slightly back behind this foot. That's going to pump the anterior fibers. Those are the costovertebral fibers. If you want to pump the intermediate fibers, which are the iliovertebral fibers, which I talked about, are continue to create a caudal thickening of the iliolumbar ligaments at L4, L5, you actually want to have the client slightly roll backwards from this position and bring this leg, top leg, slightly in front of the knee. And that's going to get the more intermediate fibers. So the position that I'm going to be in is exactly the same for all of them. Depending what fibers you want to get based on your assessment and what you do is basically going to help you or determine what position you want to put your client in. So just to review, this is vertical, posterior fibers. Anterior fibers, the person goes forward, the leg comes back slightly. For the intermediate fibers, iliovertebral fibers, patient rolls back, the leg comes just slightly forward. So I'm going to do the vertical just for the purpose of the video. This is my wife's beautiful back. So you want to actually be over the patient in a nice, comfortable position. You've got to look at table height and all that. For the purpose of the video, it's not perfect, but it's going to work. You want one arm on the iliac crest, one arm on the 12th rib, and you basically want to create a separation going this way by using your body and leaning into your arms. So if I had 2 arrows, I'd put an arrow going this way, an arrow going that way, and that's the separation that I'm doing. Now, you can actually pump the facet joints or the lamina of the lumbar spine by putting your fingers here as well. You'll get some other muscles. If you want to kind of kill 2 birds with 1 stone, you can do that. And you're going to apply a lifting tension as well as a lateral tension. So a lateral tension and a lifting tension, if you want to add that in. If not, just a lateral, kind of lateral tension. And you're not really pushing with your arms. Okay, I'll keep my hands up so you can see. You're kind of using your body to spread. Now what you want to do is, you're going to ask your client to inhale, really listen to the body and feel what's going on, and exhale. She's going to inhale again. And on 2/3 exhale, there's 2 ways to do it. You can release suddenly and get the tension again on that exhalation. She's going to inhale. Hopefully you can see this. On exhalation 2/3, slow release. Sink back into that tension that you create laterally. Inhale. On the exhalation, 2/3. Quite a quick release. It's like a pump. It's like I'm creating a tension. She exhales 2/3. I release quickly and come back into the tension. That's one way to do it. Or some people teach it where, same thing, she's going to inhale. On 2/3 exhalation, you're just going to release and sink with it. And then create tension again. Inhale. exhale, work with the body, listen to it. 2/3 just release and sync with it, and then go back into the tension. So there's a couple ways that you can do it. Now, when you do this, you're not pushing down. My weight is not going down. It's being pushed laterally, 12th rib iliac crest. I like to pull this one in and create more of a superior tension here. So as she inhales and then exhales, I do a quick release, and then I create the tension again. Inhale. You can do a slow release, do the arms first, then the hands, and then get back into the tension to create that pump. So there's a couple ways you can do it. So hopefully you enjoyed the YouTube clip. You learned a little bit about pumping. Obviously it's really quick, 10 minutes. You can't get everything from the video, but hopefully it introduced you to these techniques, the intricacies of the Quadratus Lumborum, and to my wife's beautiful back.